Question 1. System analysis indicates that the cardiology department has submitted an urgent request for a significant budget increase to acquire new, advanced diagnostic equipment, citing potential improvements in patient outcomes and competitive pressures. The Chief Financial Officer, CFO, must decide how to proceed. Which of the following represents the most appropriate and professionally responsible approach for the CFO? Option A. Conduct a thorough review of the cardiology department's request, including a detailed cost-benefit analysis, assessment of its impact on other departments' budgets, and alignment with the organization's overall strategic financial plan before making a decision. Option B. Deny the request outright, as budget increases are generally discouraged during the current fiscal year to maintain overall financial stability. Option C. Delegate the decision entirely to the cardiology department head, trusting their expertise and judgment regarding their departmental needs. Option D. Immediately approve the budget increase to ensure the cardiology department remains competitive and can offer the latest patient care technologies. The correct answer is A. Conduct a thorough review of the cardiology department's request, including a detailed cost-benefit analysis, assessment of its impact on other departments' budgets, and alignment with the organization's overall strategic financial plan before making a decision. Explanation. This scenario presents a professional challenge because it requires balancing the immediate financial needs of a specific department with the overall strategic financial health and long-term viability of the healthcare organization. The Chief Financial Officer, CFO, must navigate competing stakeholder interests, ensuring that budget decisions are not only responsive to departmental requests, but also aligned with regulatory requirements and ethical obligations to all patients and the community. The pressure to meet immediate operational demands can sometimes conflict with the need for prudent financial stewardship and investment in future capabilities. The correct approach involves a comprehensive review of the proposed budget adjustments, considering their impact on all affected departments, patient care quality, and the organization's ability to meet its mission and regulatory obligations. This approach prioritizes data-driven decision-making, stakeholder engagement, and adherence to established financial policies and governmental regulations governing healthcare finance. Specifically, it aligns with the principles of sound financial management expected of healthcare professionals, emphasizing transparency, accountability, and the responsible allocation of resources to ensure sustainable operations and quality patient care, as implicitly guided by the ethical standards and regulatory frameworks applicable to healthcare financial professionals in the U.S. An incorrect approach would be to immediately approve the cardiology department's request without thorough due diligence. This fails to consider the potential negative ripple effects on other departments, such as reduced funding for essential services or necessary capital investments in other critical areas. Ethically, this could be seen as preferential treatment, potentially undermining fairness and equity in resource allocation across the organization. Another incorrect approach would be to dismiss the cardiology department's concerns outright without a proper review. This demonstrates a lack of responsiveness to operational needs and can damage interdepartmental relationships, hindering collaboration and potentially impacting staff morale and retention. It also fails to acknowledge the potential for legitimate financial pressures within a department that could, if unaddressed, impact patient care. A third incorrect approach would be to approve the request based solely on the persuasive arguments of the department head, without validating the underlying financial data or exploring alternative solutions. This bypasses the necessary analytical rigor and could lead to suboptimal financial decisions that do not serve the best interests of the entire organization or its patients. It neglects the professional responsibility to ensure that all financial decisions are grounded in objective analysis and strategic alignment. The professional decision-making process for similar situations should involve a structured approach. First, thoroughly understand the request and its justification. Second, gather and analyze relevant financial data and operational impact assessments. Third, consult with relevant stakeholders, including department heads, other financial leaders, and potentially the board. Fourth, evaluate the request against organizational strategic goals, budget constraints, and regulatory requirements. And finally, communicate the decision and its rationale clearly and transparently. Question 2. Comparative studies suggest that the integration of electronic health records (EHR) with financial management systems presents unique challenges for healthcare organizations. Considering the regulatory framework for healthcare financial professionals, which of the following risk assessment approaches is most aligned with ensuring both financial integrity and patient data protection? Option A. Adopting a reactive stance, addressing data breaches or privacy violations only when they are detected, and then initiating a review of the affected systems. Option B. Implementing new system features and upgrades as they become available to enhance operational efficiency, with security and privacy reviews conducted only after the new functionalities are deployed. Option C. Focusing primarily on the accuracy and timeliness of financial reports generated by the integrated systems, assuming that system vendors have adequately addressed security and privacy concerns. Option D. Conducting a comprehensive risk assessment that evaluates potential vulnerabilities in system access controls, data encryption, audit trails, and vendor security practices, prioritizing mitigation efforts based on likelihood and impact. The correct answer is D. Conducting a comprehensive risk assessment that evaluates potential vulnerabilities in system access controls, data encryption, audit trails, and vendor security practices, prioritizing mitigation efforts based on likelihood and impact. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare financial management, balancing the need for robust financial data integrity with the imperative of patient privacy and data security, particularly in the context of evolving electronic health records (EHR) and integrated financial systems. The professional challenge lies in identifying and mitigating risks that could compromise both financial accuracy and regulatory compliance without hindering operational efficiency or patient care. Careful judgment is required to prioritize risk mitigation strategies that align with the specific regulatory landscape governing healthcare financial professionals. Correct approach analysis. The correct approach involves a proactive and systematic risk assessment focused on identifying potential vulnerabilities in the EHR and financial management systems that could lead to data breaches, financial misstatements, or noncompliance with regulations like HIPAA, Health Insurance Portability and Accountability Act, in the U.S. context. This includes evaluating access controls, data encryption, audit trail, vendor security practices, and disaster recovery plans. By prioritizing risks based on their likelihood and potential impact, healthcare financial professionals can allocate resources effectively to implement appropriate controls and safeguards. This aligns with the ethical duty to protect patient information and ensure the accuracy of financial reporting, as mandated by professional standards and regulatory bodies. Incorrect approach is analysis. Focusing solely on the financial reporting accuracy without a commensurate emphasis on data security and privacy controls represents a significant regulatory and ethical failure. This approach overlooks the interconnectedness of EHRs and financial systems and the potential for data breaches to have severe financial and reputational consequences, including substantial fines under HIPAA. Prioritizing system upgrades and new feature implementation without a thorough risk assessment of their impact on existing data security and privacy protocols is also problematic. New systems, while offering potential benefits, can introduce unforeseen vulnerabilities if not rigorously vetted for compliance and security. This can lead to breaches or noncompliance, exposing the organization to legal and financial penalties. Adopting a reactive approach, addressing security and privacy concerns only after an incident has occurred, is a critical failure. This demonstrates a lack of due diligence and a disregard for preventative measures. Regulatory frameworks emphasize a proactive stance on data protection, and a reactive strategy can result in significant harm to patients and the organization, leading to severe penalties and loss of trust. Professional reasoning. Healthcare financial professionals must adopt a risk-based approach that integrates financial integrity with robust data security and patient privacy. This involves 1. Understanding the regulatory environment. Familiarity with relevant laws and regulations, e.g., HIPAA in the U.S., is paramount. 2. Systematic risk identification. Regularly identify potential threats and vulnerabilities across all financial and health information systems. 3. Risk prioritization. Assess the likelihood and impact of identified risks to focus mitigation efforts. 4. Control implementation. Develop and implement appropriate technical, administrative, and physical safeguards. 5. Continuous monitoring and review. Regularly review and update risk assessments and control measures to adapt to evolving threats and technologies. 6. Ethical considerations. Always prioritize patient privacy and data confidentiality alongside financial stewardship. Question 3. Compliance review shows that a healthcare system's financial statements have been analyzed using only trend analysis of raw dollar amounts for revenue and expenses over the past 3 years. While this shows general increases, it does not provide insight into the relative changes in cost structures or the proportion of different revenue sources. Which of the following approaches, when used in conjunction with trend analysis, would best enhance the understanding of the healthcare system's financial performance and operational efficiency for compliance and strategic planning purposes? Option A. Employing common size analysis to standardize financial statement line items as a percentage of total revenue or total assets. Option B. Performing a sensitivity analysis on projected future revenues based on a single economic indicator. Option C. Focusing solely on liquidity ratios to assess the organization's short-term solvency. Option D. Conducting a detailed variance analysis of budgeted versus actual expenses without comparing to prior periods. The correct answer is A. Employing common size analysis to standardize financial statement line items as a percentage of total revenue or total assets. Explanation. This scenario presents a professional challenge because it requires a healthcare financial professional to interpret financial statement analysis beyond simple calculation. The challenge lies in understanding the implications of these analyses for operational efficiency, strategic decision-making, and regulatory compliance within the specific context of a healthcare organization. A superficial understanding could lead to misinterpretations that negatively impact patient care or financial stability. The correct approach involves using common size analysis to understand the relative proportions of different line items within financial statements. This method allows for a standardized comparison across different periods or against industry benchmarks, highlighting significant shifts in cost structures or revenue composition. For a healthcare organization, this is crucial for identifying trends in areas like patient service revenue, operating expenses, and the impact of third-party payer reimbursements. Regulatory frameworks, such as those governing Medicare and Medicaid reporting, e.g., CMS guidelines, often require detailed breakdowns and comparisons of financial performance, making common size analysis a vital tool for demonstrating financial health and compliance. Ethically, it ensures transparency and accountability in financial reporting. An incorrect approach would be to solely rely on trend analysis without considering the underlying causes or the relative significance of the trends. For example, observing an increase in a particular expense over time is less informative than understanding if that expense has grown disproportionately compared to revenue or other expenses, which common size analysis would reveal. This failure to contextualize trends can lead to misallocation of resources or overlooking critical operational issues. Another incorrect approach is to focus only on ratio analysis without considering the broader financial picture or the specific operational context of a healthcare provider. Ratios can be misleading if not interpreted alongside other analytical methods and an understanding of the healthcare environment, potentially leading to flawed strategic decisions that could jeopardize the organization's ability to provide care. The professional reasoning process should involve a multifaceted approach to financial statement analysis. Professionals must first understand the specific regulatory requirements applicable to their healthcare organization. Then, they should select analytical tools that best address the questions at hand, recognizing that no single method is sufficient. Common size analysis provides a foundational understanding of financial structure, trend analysis reveals performance over time, and ratio analysis offers insights into efficiency and solvency. The critical step is to synthesize the findings from these different approaches, considering the unique operational and regulatory environment of healthcare, to form a comprehensive and actionable assessment. Question 4. Investigation of the implementation of a new patient financial services initiative aimed at improving payment collection rates. What approach best balances the organization's financial objectives with its ethical and regulatory obligations to patients, particularly those experiencing financial hardship? Option A. Offering a discount for immediate lump sum payments only, without providing any installment options or financial assistance programs for patients unable to meet this requirement. Option B. Implementing a tiered payment plan system that offers various installment options based on the patient's outstanding balance, with clear, easily accessible documentation outlining the terms and conditions of each plan, and providing dedicated financial counselors to assist patients in selecting the most suitable option. Option C, relying solely on automated online payment portals with minimal customer support, assuming patients will independently navigate and select payment options that fit their financial capabilities. Option D, mandating a single, short-term payment plan for all outstanding balances above a certain threshold, with immediate escalation to external collection agencies for any noncompliance, without offering individualized assessments or alternative arrangements. The correct answer is B, implementing a tiered payment plan system that offers various installment options based on the patient's outstanding balance, with clear, easily accessible documentation outlining the terms and conditions of each plan, and providing dedicated financial counselors to assist patients in selecting the most suitable option. Explanation: this scenario presents a common implementation challenge in patient financial services, balancing the need for efficient payment processing with the ethical and regulatory imperative to provide accessible and understandable payment options to all patients, particularly those facing financial hardship. The challenge lies in designing and communicating payment plans that are both compliant with healthcare regulations and genuinely helpful to patients, avoiding practices that could be construed as predatory or discriminatory. Careful judgment is required to ensure that the organization's financial goals do not overshadow its commitment to patient care and financial well-being. The correct approach involves proactively offering a range of flexible, clearly communicated payment options that are tailored to individual patient circumstances, including options for those with limited income or insurance coverage. This approach aligns with the ethical principles of patient advocacy and financial stewardship, and it is supported by regulatory frameworks that emphasize transparency and fairness in billing and collections. Specifically, it addresses the spirit of regulations like the Affordable Care Act, ACA, and its provisions related to financial assistance policies, and prohibits discriminatory practices in billing. By providing clear information about available options and actively assisting patients in navigating them, the organization demonstrates a commitment to patient-centered care and compliance. An incorrect approach that focuses solely on maximizing immediate collections without considering patient ability to pay or offering adequate support fails to meet regulatory and ethical standards. This could lead to patients incurring unmanageable debt, potentially violating regulations that prohibit aggressive collection tactics that are not commensurate with the patient's financial situation. Another incorrect approach that relies on a single, rigid payment plan option, regardless of individual patient circumstances, demonstrates a lack of flexibility and can disproportionately burden vulnerable patient populations, potentially leading to accusations of discrimination and noncompliance with fair billing practices. Finally, an approach that fails to clearly communicate the terms and conditions of payment options, or that uses complex jargon, creates confusion and can lead to misunderstandings, which is a failure in transparency and patient education, a key component of ethical financial services. Professionals should approach such situations by first understanding the full spectrum of patient financial needs and the regulatory landscape governing healthcare billing. This involves developing a patient-centric financial assistance policy that is transparent, accessible, and offers a variety of payment solutions. Regular training for staff on these policies and on empathetic communication techniques is crucial. When faced with implementation challenges, the decision-making process should prioritize patient well-being and regulatory compliance, seeking to find solutions that are mutually beneficial and uphold the organization's ethical obligations. Question 5. Governance review demonstrates that the healthcare organization is considering several capital investment proposals. The Finance Committee is tasked with recommending which projects to pursue. Which of the following approaches to evaluating these proposals best aligns with the principles of sound capital budgeting and responsible financial stewardship within the healthcare sector, considering the need for both financial viability and strategic alignment with patient care objectives? Option A. Prioritize projects solely based on the highest net present value (NPV), assuming all projects meet a minimum hurdle rate. Option B. Focus exclusively on the internal rate of return for all projects, as it represents the project's inherent profitability. Option C. Select projects that offer the quickest payback period, even if their NPV is only marginally positive and their IRR is below the organization's cost of capital. Option D. Evaluate projects using a combination of net present value, NPV, internal rate of return and payback period, while also conducting a qualitative assessment of strategic fit, operational impact, and regulatory compliance risks. The correct answer is A. Prioritize projects solely based on the highest net present value, NPV, assuming all projects meet a minimum hurdle rate. Explanation. This scenario is professionally challenging because it requires balancing financial prudence with strategic investment decisions within the specific regulatory and ethical landscape of healthcare finance. The decision maker must consider not only the potential financial returns of capital projects, but also their alignment with the organization's mission, patient care objectives, and long-term sustainability, all while adhering to the strict guidelines governing healthcare financial professionals. The correct approach involves a comprehensive risk assessment that integrates financial metrics with qualitative factors relevant to healthcare. This means evaluating the net present value, NPV, to understand the project's value in today's dollars, considering the time value of money and the required rate of return. It also involves assessing the internal rate of return to determine the project's inherent profitability relative to the cost of capital. Furthermore, the payback period is crucial for understanding liquidity and the speed at which an investment is recouped, which is particularly important in healthcare where cash flow can be unpredictable. Critically, a robust risk assessment will also incorporate an analysis of operational risks, regulatory compliance risks, and the potential impact on patient care quality and access. This holistic view ensures that capital allocation decisions are not only financially sound, but also strategically aligned with the organization's core purpose and ethical obligations, as mandated by professional standards for healthcare financial professionals. An approach that solely focuses on maximizing the NPV without considering the payback period or qualitative risks would be incorrect. This failure to consider liquidity and the time required to recoup investment could lead to a project that appears profitable on paper, but strains the organization's short-term financial health, potentially jeopardizing ongoing operations or the ability to fund essential services. This overlooks the practical realities of healthcare finance and the importance of cash flow management. An approach that prioritizes the shortest payback period above all other considerations, even if it means accepting projects with lower NPV or higher risk profiles, would also be professionally unsound. While liquidity is important, an exclusive focus on rapid payback can lead to the rejection of valuable long-term investments that might have a slightly longer payback, but offer significantly greater overall value and strategic advantage. This narrow focus can stifle innovation and long-term growth. An approach that ignores the IRR and focuses only on NPV and payback period would be incomplete. The IRR provides a critical measure of a project's profitability relative to its cost, offering a different perspective on investment attractiveness. Failing to consider the IRR means missing a key indicator of a project's efficiency and potential to generate returns above the cost of capital, potentially leading to suboptimal investment choices. The professional decision-making process for similar situations should involve a structured evaluation of all relevant capital budgeting techniques, NPV, payback period, and a thorough qualitative assessment of risks and strategic alignment. This includes understanding the specific regulatory environment and ethical considerations applicable to healthcare organizations. Professionals should establish clear investment criteria that incorporate both quantitative financial measures and qualitative factors, ensuring that decisions are transparent, defensible, and in the best interest of the organization and its stakeholders. Question 6. The efficiency study reveals that patient access to scheduled services is being significantly delayed due to a backlog in obtaining necessary pre-authorizations from insurance payers. Which of the following approaches would best optimize the patient access process while adhering to regulatory and payer requirements? Option A. Shifting the responsibility for obtaining pre-authorizations entirely to the clinical departments after the patient has already been seen, with a focus on resolving denials post-service. Option B. Implementing a centralized, technology-enabled pre-authorization unit that initiates the process at the point of service scheduling and actively tracks approvals, integrating this data into the patient registration system. Option C. Establishing a policy to bypass pre-authorization requirements for all elective procedures to expedite patient throughput, relying on post-service verification. Option D. Assigning all pre-authorization tasks to frontline registration staff without providing specialized training or additional resources, expecting them to manage the process alongside their existing duties. The correct answer is B. Implementing a centralized, technology-enabled pre-authorization unit that initiates the process at the point of service scheduling and actively tracks approvals, integrating this data into the patient registration system. Explanation: the efficiency study reveals significant delays in patient access due to a bottleneck in the pre-authorization process. This scenario is professionally challenging because it directly impacts patient care, financial viability of the healthcare organization, and compliance with payer requirements. Balancing the need for timely patient registration and insurance verification with the administrative burden of pre-authorizations requires careful judgment. The correct approach involves implementing a proactive, technology-driven pre-authorization workflow that integrates seamlessly with registration and insurance verification. This approach prioritizes obtaining pre-authorizations as early as possible in the patient journey, ideally at the point of scheduling or initial contact. This minimizes downstream delays, reduces claim denials, and ensures patients are aware of their financial responsibilities and coverage limitations upfront. This aligns with regulatory expectations for efficient revenue cycle management and ethical patient care, as delays can lead to postponed or foregone treatment. An incorrect approach would be to solely rely on manual follow-up for pre-authorizations after the patient has already been registered and received services. This reactive strategy leads to significant delays, increased administrative costs for rework and appeals, and potential financial hardship for patients who may not be aware of coverage issues until much later. It also risks non-compliance with payer contracts that stipulate pre-authorization requirements for certain services, potentially leading to claim denials and revenue loss. Another incorrect approach is to bypass pre-authorization checks for certain high-volume or urgent services without a robust internal risk assessment and mitigation plan. While intended to speed up access, this can expose the organization to significant financial risk if services are deemed not medically necessary or not covered by the payer, leading to uncompensated care. It also undermines the integrity of the revenue cycle and payer relationships. A third incorrect approach is to overburden the registration staff with complex pre-authorization tasks for which they may not have adequate training or resources. This can lead to errors, delays, and staff burnout, ultimately hindering the efficiency of both registration and the pre-authorization process. Professionals should adopt a decision-making framework that emphasizes a holistic view of the patient access process. This involves analyzing workflows for potential bottlenecks, leveraging technology to automate and streamline tasks, ensuring appropriate staff training and resource allocation, and establishing clear communication channels between registration, clinical, and billing departments. The goal is to create a patient-centric process that is both efficient and compliant, minimizing financial risk and maximizing positive patient outcomes. Question 7. The review process indicates a proposed financial arrangement where a hospital proposes to pay a physician group for providing certain administrative services related to patient care coordination. The compensation is based on a per-patient fee, and the physician group is also a significant referral source for the hospital. What is the most appropriate approach to assess the stark law implications of this arrangement? Option A. Evaluate if the compensation is commercially reasonable and directly related to legitimate services provided, ensuring it is not tied to the volume or value of referrals, and that a written agreement is in place. Option B. Focus solely on the fact that the physician group provides administrative services, as this is generally considered a legitimate business function. Option C. Assume the arrangement is compliant because it involves administrative services and the physician group is a valuable referral source for the hospital. Option D. Proceed with the arrangement as long as the per-patient fee is competitive with other hospitals in the region, without further detailed scrutiny of the stark law exceptions. The correct answer is A. Evaluate if the compensation is commercially reasonable and directly related to legitimate services provided, ensuring it is not tied to the volume or value of referrals, and that a written agreement is in place. Explanation: this scenario is professionally challenging because it requires a nuanced understanding of the Stark Law's complex provisions and exceptions, particularly concerning physician compensation arrangements and potential conflicts of interest within a healthcare system. The core challenge lies in discerning whether a proposed financial arrangement, while seemingly beneficial, could inadvertently violate the prohibition against self-referral, thereby compromising patient care decisions and increasing healthcare costs. Careful judgment is required to navigate the intricate web of regulations designed to prevent physicians from profiting from referrals. The correct approach involves a thorough examination of the proposed compensation arrangement against the specific requirements of the Stark Law's exceptions. This includes verifying that the compensation is for legitimate services, is commercially reasonable, is determined in advance, and does not take into account the volume or value of referrals. Adhering to these detailed requirements ensures compliance and protects the integrity of patient care decisions. An incorrect approach that fails to consider the commercially reasonable standard would be problematic. This standard requires that the compensation reflects the fair market value of the services provided, independent of the volume or value of any referrals. Ignoring this aspect could lead to arrangements where compensation is inflated, creating an incentive for self-referral, which is precisely what Stark Law aims to prevent. Another incorrect approach would be to assume that any arrangement with a physician group automatically qualifies for an exception without scrutinizing the specific terms. The Stark Law is highly fact-specific, and broad assumptions can lead to significant violations. Each arrangement must be evaluated individually against the applicable exceptions. Finally, an approach that overlooks the requirement for compensation to be determined in advance and documented in a written agreement would also be a failure. This ensures transparency and allows for proper oversight and auditing. Without these safeguards, the potential for abuse increases. Professionals should employ a decision-making framework that prioritizes a comprehensive understanding of the Stark Law's intent and specific provisions. This involves consulting with legal counsel specializing in healthcare law, conducting thorough due diligence on all physician compensation arrangements, and maintaining meticulous documentation to demonstrate compliance. A proactive approach to identifying and mitigating potential risks is crucial. Question 8. Benchmark analysis indicates that healthcare facilities often face complex situations when individuals present to their emergency departments without immediate means of payment. In such a scenario, a patient arrives at the hospital's emergency department exhibiting symptoms suggestive of a serious medical condition, but the patient states they have no insurance and cannot afford to pay for services. The Financial Services Department is immediately notified. Which of the following represents the most appropriate course of action for the hospital's emergency department staff to ensure compliance with federal regulations? Option A. Inform the patient that services cannot be rendered until a deposit is paid or a payment plan is established, and advise them to seek care at a facility that accepts their insurance or offers charity care. Option B. Perform a limited medical screening examination to assess the patient's ability to pay, and if unable to pay, refer them to a public health clinic or a different hospital that may offer more affordable care. Option C. Conduct an appropriate medical screening examination to determine if an emergency medical condition exists, and if so, provide stabilizing treatment within the hospital's capabilities, deferring financial discussions until after the patient is stabilized or appropriately transferred. Option D. Initiate immediate stabilization treatment without a formal medical screening examination, assuming the patient's symptoms indicate an emergency, to avoid any potential EMTALA violations related to delay. The correct answer is C. Conduct an appropriate medical screening examination to determine if an emergency medical condition exists, and if so, provide stabilizing treatment within the hospital's capabilities, deferring financial discussions until after the patient is stabilized or appropriately transferred. Explanation: this scenario is professionally challenging because it requires immediate decision-making under pressure, balancing patient care needs with hospital financial considerations, all while strictly adhering to EMTALA regulations. The core challenge lies in correctly identifying a patient's medical need for an appropriate medical screening examination and stabilization, irrespective of their ability to pay or insurance status. Misinterpreting these obligations can lead to severe legal and ethical repercussions. The correct approach involves prioritizing the patient's immediate medical needs as dictated by EMTALA. This means ensuring that any individual presenting to the hospital's emergency department with an emergency medical condition receives an appropriate medical screening examination to determine if such a condition exists. If an emergency medical condition is found, the hospital must provide such medical treatment as is necessary to stabilize the condition within the capabilities of the hospital. This approach is ethically sound and legally mandated by EMTALA, which places a non-negotiable obligation on participating hospitals to provide emergency care. An incorrect approach would be to delay or refuse a medical screening examination based on the patient's lack of insurance or inability to pay upfront. This directly violates EMTALA core principle of providing emergency care without discrimination based on financial status. Another incorrect approach would be to perform a cursory examination that does not adequately assess for an emergency medical condition, or to fail to stabilize a patient once an emergency medical condition is identified. These actions represent a failure to meet the statutory requirements of EMTALA and can result in significant penalties, including fines and potential exclusion from Medicare. Furthermore, any approach that prioritizes financial gain or administrative convenience over the patient's immediate medical needs is ethically unacceptable and legally noncompliant. The professional reasoning process for similar situations should involve a clear understanding of EMTALA requirements, a commitment to patient advocacy, and a robust internal policy framework that guides staff in handling such cases. When faced with a patient presenting with a potential emergency, the immediate step should be to initiate the medical screening process and assess for stabilization needs, deferring financial discussions until after these critical medical obligations are met. Question 9. Assessment of the strategic implications for a healthcare provider transitioning from a traditional fee-for-service reimbursement model to alternative payment methodologies, considering the impact on financial sustainability and quality of care delivery under U.S. healthcare regulations. Option A. Negotiating higher reimbursement rates for individual services within the fee-for-service framework to maximize immediate revenue. Option B. Increasing the volume of services provided under the existing fee-for-service model to offset potential revenue fluctuations from new payment models. Option C. Adopting a bundled payment approach for specific episodes of care, focusing on care coordination and outcome measurement to align with value-based purchasing initiatives. Option D. Implementing a pure capitation model without investing in population health management infrastructure, assuming a stable patient enrollment. Correct answer is C. Adopting a bundled payment approach for specific episodes of care, focusing on care coordination and outcome measurement to align with value-based purchasing initiatives. Explanation. This scenario presents a professional challenge because healthcare organizations must strategically align their reimbursement models with evolving regulatory landscapes and patient care objectives. The choice of reimbursement approach significantly impacts financial stability, operational efficiency, and the quality of care delivered. Careful judgment is required to select a model that balances financial viability with the organization's mission and compliance with healthcare financial regulations. The correct approach involves understanding the fundamental differences between fee-for-service, capitation, and bundled payments, and how each aligns with different healthcare delivery and payment philosophies. Fee-for-service, while historically dominant, can incentivize volume over value. Capitation shifts risk to providers, requiring robust population health management. Bundled payments aim to coordinate care across an episode of illness, promoting efficiency and quality outcomes. A professional must assess which model best supports the organization's strategic goals, patient population needs, and the current regulatory environment, which increasingly favors value-based care. An incorrect approach would be to solely focus on maximizing revenue under a fee-for-service model, without considering the long-term implications of value-based purchasing initiatives, or the potential for increased administrative burden and patient dissatisfaction due to fragmented care. This ignores the regulatory shift towards outcomes and efficiency. Another incorrect approach would be to adopt a capitation model without adequate infrastructure for population health management, leading to financial risk and potential underprovision of care, which could violate ethical obligations and potentially regulatory requirements related to patient access and quality. Implementing bundled payments without effective care coordination mechanisms across providers would also be an incorrect approach, as it could lead to cost overruns and compromise patient outcomes, failing to meet the intended goals of the payment model, and potentially violating contractual obligations. Professional decision-making in this context requires a thorough analysis of the organization's capabilities, the specific patient population served, and the prevailing reimbursement trends and regulations. It involves evaluating the financial implications, operational requirements, and quality outcomes associated with each model. Professionals should engage in strategic planning that considers the long-term sustainability and alignment with value-based care principles, rather than relying on outdated or poorly implemented reimbursement strategies. Question 10. Upon reviewing the financial performance of a healthcare organization, a financial analyst observes that the days in accounts receivable (DAR) has significantly decreased over the past quarter, while the clean claim rate has remained stable. The analyst is tasked with assessing the implications of these trends for the organization's financial health and compliance. Which of the following interpretations best reflects a comprehensive understanding of these revenue cycle metrics within the U.S. regulatory framework for healthcare financial professionals? Option A. The decrease in DAR, while seemingly positive, could be a result of the organization delaying the submission of claims to payers, thereby artificially lowering the days outstanding without actually improving cash flow. Option B. The stable clean claim rate, despite the decrease in DAR, might signal that the organization is prematurely writing off outstanding balances to artificially lower its DAR, which could mask underlying financial issues. Option C. The decrease in DAR indicates a potential issue with aggressive collection practices that may be negatively impacting patient satisfaction and potentially violating fair debt collection regulations. Option D. The decrease in DAR, coupled with a stable clean claim rate, suggests improved operational efficiency in billing and collections, leading to faster reimbursement without compromising claim accuracy. The correct answer is D. The decrease in DAR, coupled with a stable clean claim rate, suggests improved operational efficiency in billing and collections, leading to faster reimbursement without compromising claim accuracy. Explanation: this scenario is professionally challenging because it requires a nuanced understanding of how different revenue cycle metrics, specifically days in accounts receivable (DAR) and clean claim rate, are interconnected, and how their performance impacts overall financial health and regulatory compliance within a healthcare organization. Misinterpreting the relationship or focusing on one metric in isolation can lead to flawed strategic decisions that may inadvertently violate regulatory requirements or ethical standards. The correct approach involves recognizing that while a low DAR is generally desirable, it must be achieved without compromising the clean claim rate. A low DAR achieved by aggressive, potentially non-compliant, collection tactics or by prematurely writing off uncollectible accounts would be detrimental. Conversely, a high clean claim rate is essential for maximizing reimbursement and minimizing administrative burden. But if it leads to an excessively high DAR due to slow payment processing or denial management, it also signals inefficiency. Therefore, the most effective approach is to analyze both metrics in tandem, understanding that optimal performance requires a balance where claims are submitted accurately and promptly, leading to timely payment and a reasonable DAR. This aligns with the principles of efficient healthcare financial management and implicitly supports regulatory frameworks that emphasize accurate billing and timely reimbursement, such as those governed by the Centers for Medicare and Medicaid Services, CMS, in the U.S. An incorrect approach would be to solely focus on reducing DAR by implementing aggressive collection efforts that may not adhere to fair debt collection practices, or by expediting claim submission without thorough review, thereby increasing claim denials and negatively impacting the clean claim rate. This could lead to violations of patient billing regulations and potentially prompt investigations into billing improprieties. Another incorrect approach would be to prioritize a high clean claim rate at the expense of timely collections, leading to an inflated DAR. While seemingly compliant in terms of claim accuracy, this inefficiency can strain cash flow, potentially impacting the organization's ability to meet its financial obligations and provide patient care, which indirectly contravenes the spirit of financial stewardship expected of healthcare professionals. Professionals should employ a decision-making framework that involves continuous monitoring and analysis of key performance indicators like DAR and clean claim rate. This framework should include understanding the root causes of deviations in these metrics, such as denial trends, payer processing times, and internal workflow inefficiencies. The goal is to identify strategies that improve both metrics simultaneously, ensuring compliance with all applicable healthcare financial regulations and ethical obligations to patients and payers. This involves a holistic view of the revenue cycle, not just isolated data points. Question 11. Process analysis reveals that a healthcare organization is struggling to achieve meaningful use criteria for its newly implemented electronic health record (EHR) system, with significant staff resistance and data entry inconsistencies observed. Which of the following implementation strategies would best address these challenges and align with regulatory expectations for EHR adoption and effective use? Option A. Focus on achieving cost savings by limiting ongoing training and support resources after the initial EHR deployment, assuming staff will adapt over time. Option B. Mandate immediate, system-wide adoption of all EHR features with minimal training, focusing on rapid deployment to meet initial regulatory deadlines. Option C. Prioritize technical configuration of the EHR system to meet certification standards, with minimal emphasis on adapting clinical workflows or providing extensive user support. Option D. Implement a phased rollout of EHR functionalities, prioritizing comprehensive, role-specific staff training and workflow integration before expanding to new modules or departments. The correct answer is D. Implement a phased rollout of EHR functionalities, prioritizing comprehensive, role-specific staff training and workflow integration before expanding to new modules or departments. Explanation. This scenario presents a common challenge in healthcare IT implementation, balancing the drive for efficiency and regulatory compliance with the practical realities of user adoption and data integrity. The professional challenge lies in navigating the complexities of electronic health records, (EHR) implementation, specifically concerning the meaningful use objectives, which are critical for reimbursement and quality reporting under U.S. federal regulations. Careful judgment is required to ensure that the chosen approach not only meets technical and regulatory mandates, but also fosters effective use by clinical staff, ultimately impacting patient care and financial performance. The correct approach involves a phased rollout strategy that prioritizes comprehensive staff training and robust workflow integration. This strategy is justified by the U.S. regulatory framework for meaningful use, now part of the Promoting Interoperability programs, which emphasizes not just the adoption of certified EHR technology, but also its effective use in improving patient care, engaging patients, and improving population health. A phased approach allows for iterative refinement of workflows, targeted training based on observed user challenges, and a more manageable integration into daily clinical practice, thereby increasing the likelihood of achieving meaningful use criteria and avoiding penalties. This aligns with ethical considerations of ensuring technology supports, rather than hinders, quality patient care. An incorrect approach that bypasses comprehensive training in favor of a rapid, system-wide deployment risks significant user resistance and errors. This failure directly contravenes the spirit and intent of meaningful use, which requires demonstrated use of the EHR to improve care. Such an approach could lead to incomplete or inaccurate data entry, hindering reporting capabilities, and potentially resulting in noncompliance with regulatory requirements for quality reporting and incentive payments. Ethically, it compromises patient safety by introducing potential for medical errors due to unfamiliarity with the system. Another incorrect approach, focusing solely on technical configuration without adequate consideration for clinical workflow redesign, also fails to meet meaningful use objectives. While the technology may be certified, its inability to seamlessly integrate into existing or optimized clinical processes will lead to user frustration and underutilization. This can result in missed opportunities to leverage EHR functionalities for improved care coordination, patient engagement, and data analytics, all of which are core to meaningful use. Regulatory bodies expect demonstrable improvements in care delivery, not just the presence of compliant software. A third incorrect approach, prioritizing immediate cost savings by limiting ongoing support and training post-implementation, is also flawed. Meaningful use is an evolving standard, and EHR systems require continuous adaptation and user support to maintain optimal performance and compliance. Neglecting post-implementation support can lead to a decline in user proficiency, increased workarounds that bypass intended functionalities, and ultimately, a failure to achieve or sustain meaningful use. This can jeopardize future incentive payments and create long-term operational inefficiencies. Professionals should employ a decision-making framework that begins with a thorough assessment of current clinical workflows and staff needs. This should be followed by a strategic selection of EHR functionalities that align with meaningful use objectives and organizational goals. A phased implementation plan, incorporating extensive, role-specific training and ongoing support, is crucial. Regular evaluation of user adoption, data quality, and progress towards meaningful use metrics should inform iterative adjustments to the system and training programs. This systematic approach ensures that technology adoption is driven by clinical value and regulatory compliance, rather than solely by technical implementation. Question 12. Performance analysis shows a significant increase in claim denials related to medical necessity and lack of prior authorization. The finance department is under pressure to improve the clean claim rate and reduce accounts receivable days. Which of the following approaches best balances regulatory compliance, financial stewardship, and patient advocacy in managing these denials? Option A. Instruct the coding department to retroactively adjust clinical documentation to support the medical necessity of services rendered for previously denied claims. Option B. Automatically rebill all denied claims with the same information, assuming the initial submission was correct and the denial was an administrative error. Option C. Write off all claims denied for medical necessity or lack of prior authorization to minimize administrative effort and focus on more straightforward claims. Option D. Implement a rigorous process for reviewing each denied claim, identifying the specific denial reason, gathering all necessary supporting documentation, including clinical notes and prior authorization confirmations, and submitting well-documented appeals within payer-defined timelines, while also initiating a root cause analysis to address systemic issues in front-end processes. Correct answer is D. Implement a rigorous process for reviewing each denied claim, identifying the specific denial reason, gathering all necessary supporting documentation, including clinical notes and prior authorization confirmations, and submitting well-documented appeals within payer-defined timelines, while also initiating a root cause analysis to address systemic issues in front-end processes. Explanation: this scenario is professionally challenging because it requires a healthcare financial professional to balance efficient claims processing with strict adherence to regulatory compliance and patient advocacy. The pressure to reduce denial rates and improve cash flow can tempt shortcuts, but these can lead to significant compliance violations and harm to patients. Careful judgment is required to ensure that all actions taken are both financially sound and ethically and legally defensible. The correct approach involves a systematic and compliant review of denied claims, focusing on identifying root causes and implementing corrective actions that align with payer policies and federal regulations. This approach prioritizes accurate claim submission and appeals, ensuring that legitimate patient care is reimbursed without compromising regulatory integrity. Specifically, it involves a thorough investigation of the denial reason, gathering all necessary supporting documentation, and submitting a well-documented appeal within the stipulated timeframe. This aligns with the principles of accurate billing, patient financial responsibility, and adherence to payer contracts and governmental regulations such as the False Claims Act, which prohibits knowingly submitting false or fraudulent claims for payment. An incorrect approach that involves automatically rebilling claims without investigating the denial reason is professionally unacceptable. This bypasses the crucial step of understanding why the claim was denied, potentially leading to repeated denials and increased administrative costs. It also risks submitting inaccurate information, which could be construed as fraudulent billing practices, violating regulations like the False Claims Act. Another incorrect approach, which is to write off all denied claims without further action, is also professionally unacceptable. This represents a failure to pursue legitimate revenue, impacting the financial health of the organization. More importantly, it can lead to patients being inappropriately burdened with costs for services that should have been covered by insurance, potentially violating patient protection regulations and ethical obligations to advocate for appropriate reimbursement. A third incorrect approach, which is to pressure coding staff to alter documentation to justify previously submitted claims, is highly unethical and illegal. This constitutes deliberate falsification of records, a direct violation of the False Claims Act and other anti-fraud statutes. It undermines the integrity of the billing process, erodes trust with payers and patients, and can lead to severe penalties for the organization and individuals involved. The professional decision-making process for similar situations should involve a multifaceted approach. 1. Understand the denial. Always investigate the specific reason for each denial. 2. Regulatory review. Consult relevant payer policies, Medicare/Medicaid guidelines, and federal regulations. 3. Documentation and evidence. Gather all supporting documentation to substantiate the claim. 4. Appeal strategy. Develop a clear and compliant appeal strategy based on the denial reason and available evidence. 5. Root cause analysis. For recurring denials, conduct a root cause analysis to identify systemic issues in front-end processes, e.g., registration, coding, prior authorization. 6. Corrective action. Implement corrective actions to prevent future denials. 7. Patient impact. Consider the financial impact on the patient and ensure compliance with patient billing regulations. 8. Ethical considerations. Always prioritize ethical conduct and regulatory compliance over short-term financial gains. Question 13. Implementation of artificial intelligence, specifically machine learning for predictive revenue cycle analytics and natural language processing for patient billing inquiries, in a U.S.-based healthcare organization requires a comprehensive impact assessment. Which of the following approaches best ensures compliance with U.S. healthcare financial regulations and ethical data handling? Option A. Conducting a thorough assessment of potential impacts on patient privacy, data security, algorithmic bias, and accuracy, ensuring alignment with HIPAA and other relevant U.S. regulations before and during implementation. Option B. Deploying AI solutions based on vendor assurances of compliance, without independent verification or ongoing monitoring of their adherence to U.S. healthcare financial regulations. Option C. Focusing solely on the technical capabilities of AI tools to automate tasks, assuming that regulatory compliance will be addressed through general IT security policies. Option D. Prioritizing the selection of AI tools that demonstrate the highest potential for immediate cost reduction and operational efficiency, with a secondary review of compliance requirements. The correct answer is D. Prioritizing the selection of AI tools that demonstrate the highest potential for immediate cost reduction and operational efficiency, with a secondary review of compliance requirements. Explanation. This scenario presents a professional challenge because implementing AI, specifically machine learning, ML, and natural language processing, NLP, in healthcare financial operations requires a delicate balance between leveraging technological advancements for efficiency and ensuring strict adherence to patient privacy regulations and ethical data handling practices. The potential for AI to automate tasks, improve revenue cycle management, and identify financial risks is significant, but the sensitive nature of protected health information, FI, necessitates a robust understanding of compliance requirements. Careful judgment is required to select AI applications that demonstrably improve financial outcomes without compromising patient confidentiality or introducing bias. The correct approach involves a thorough impact assessment that prioritizes regulatory compliance and ethical considerations alongside operational benefits. This means proactively identifying potential risks related to data security, privacy breaches, algorithmic bias, and the accuracy of AI-generated financial insights. It requires engaging legal and compliance teams early in the process to ensure that any AI implementation aligns with the Health Insurance Portability and Accountability Act, HIPAA, in the United States, which governs the privacy and security of health information. This approach ensures that the organization can confidently deploy AI solutions that are both effective and compliant, minimizing legal and reputational risks. An incorrect approach would be to prioritize immediate cost savings or perceived efficiency gains from AI without a comprehensive assessment of regulatory implications. For instance, deploying an ML model for claims processing without verifying its adherence to HIPAA data de-identification standards or its potential to perpetuate existing biases in reimbursement could lead to significant legal penalties and ethical breaches. Similarly, using NLP to analyze patient financial communication without ensuring that the system is designed to prevent unauthorized access to PHI or that the output is not used in a discriminatory manner would violate privacy regulations. Another incorrect approach is to assume that AI tools are inherently compliant and to bypass rigorous testing and validation procedures. This oversight fails to acknowledge the potential for AI to inadvertently create new compliance challenges or to misinterpret data in ways that could lead to financial impropriety or patient harm, thereby failing to uphold the professional duty of care and diligence. Professional decision-making in such situations should follow a structured process. First, clearly define the business objective for AI implementation. Second, conduct a comprehensive risk assessment, specifically focusing on regulatory compliance, e.g., HIPAA, High-Tech Act in the U.S., and ethical implications. Third, consult with legal, compliance, and IT security experts to vet potential AI solutions. Fourth, implement a phased rollout with continuous monitoring and auditing to ensure ongoing compliance and performance. Finally, establish clear governance policies for AI use, including data handling, bias mitigation, and accountability. Question 14. Which approach would be most effective for a hospital system to develop its annual operating budget and long-term strategic financial plan, ensuring alignment with its mission and regulatory compliance? Option A. A collaborative process involving all department heads, clinical leadership, and finance staff, utilizing historical data, current market analysis, and projected regulatory changes to inform budget allocations and strategic financial goals. Option B. A budget developed by the finance team with limited consultation, assuming current reimbursement rates and service volumes will remain constant for the foreseeable future. Option C. A top-down directive from the finance department, based primarily on extrapolating the previous year's budget with minor adjustments for inflation. Option D. A process focused solely on identifying areas for immediate cost reduction, with minimal input from operational departments to maximize short-term profitability. The correct answer is A. A collaborative process involving all department heads, clinical leadership, and finance staff, utilizing historical data, current market analysis, and projected regulatory changes to inform budget allocations and strategic financial goals. Explanation. This scenario presents a professional challenge because healthcare organizations operate in a highly regulated environment with significant public trust implications. Financial planning, particularly budgeting and forecasting, directly impacts patient care quality, resource allocation, and the organization's long-term viability. A failure in strategic financial planning can lead to operational deficiencies, non-compliance, and ultimately harm to the community served. Careful judgment is required to balance financial stewardship with the mission of providing quality healthcare. The correct approach involves a comprehensive, data-driven, and collaborative process that aligns financial projections with the organization's strategic goals and regulatory obligations. This includes engaging key stakeholders, utilizing historical data, considering market trends, and incorporating risk assessments. This approach is justified by best practices in healthcare financial management, which emphasize transparency, accountability, and forward-looking planning to ensure sustainability and compliance with regulations, such as those overseen by CMS, Centers for Medicare and Medicaid Services, and other relevant U.S. healthcare authorities. Adherence to these principles supports the organization's ability to meet its financial obligations while fulfilling its healthcare mission. An approach that relies solely on historical trends without considering future market shifts or regulatory changes is professionally unacceptable. This failure to adapt can lead to inaccurate forecasts, misallocation of resources, and potential noncompliance with evolving payment models or reporting requirements. An approach that prioritizes short-term cost reductions over long-term strategic investments, without a thorough analysis of their impact on patient care or operational efficiency, is also professionally flawed. This can undermine the organization's ability to innovate, maintain quality, and achieve its strategic objectives, potentially leading to future financial instability and reputational damage. An approach that bypasses input from key operational departments and clinical leadership during the budgeting process is problematic. This lack of collaboration can result in unrealistic budgets that do not reflect the actual needs and challenges of service delivery, leading to operational friction, decreased morale, and an inability to achieve financial targets. The professional decision-making process for similar situations should involve a structured, multifaceted approach. Professionals should first clearly define the organization's strategic objectives and then gather comprehensive data, including historical performance, current operational realities, and projected external factors, market, regulatory, economic. Engaging all relevant stakeholders in a collaborative dialogue is crucial to ensure buy-in and the development of realistic and actionable plans. Finally, a robust review and approval process, incorporating risk assessment and contingency planning, is essential to ensure the financial plan is sound, compliant, and supportive of the organization's mission. Question 15. The analysis reveals that a healthcare system is rapidly expanding its remote patient monitoring, RPM, and virtual consultation services. To ensure the financial integrity and regulatory compliance of these new telehealth offerings, which of the following risk assessment approaches is most appropriate? Option A. Conduct a retrospective analysis of historical billing data for traditional services to project telehealth revenue, assuming similar payment structures. Option B. Focus solely on the technological infrastructure required for telehealth, assuming that financial and regulatory aspects will naturally align with existing organizational policies. Option C. Implement a comprehensive, forward-looking risk assessment that systematically identifies potential financial, operational, and regulatory challenges specific to telehealth reimbursement, data security, and patient consent, and develops corresponding mitigation strategies. Option D. Rely on vendor-provided telehealth platform documentation to ensure compliance, assuming their systems are inherently secure and compliant with all relevant healthcare regulations. The correct answer is A. Conduct a retrospective analysis of historical billing data for traditional services to project telehealth revenue, assuming similar payment structures. Explanation. The analysis reveals a scenario where a healthcare organization is expanding its telehealth services, specifically remote patient monitoring, RPM, and virtual consultations, without a comprehensive understanding of the associated financial and operational risks. This is professionally challenging because the rapid adoption of new technologies in healthcare, while offering benefits, introduces complexities in revenue cycle management, compliance, and patient care coordination. A robust risk assessment is crucial to ensure financial sustainability, regulatory adherence, and quality of care. The correct approach involves a proactive and systematic identification and evaluation of potential risks related to telehealth implementation. This includes assessing reimbursement challenges for RPM and virtual visits under current Medicare and Medicaid guidelines, potential for claim denials due to improper documentation or coding, cybersecurity vulnerabilities associated with transmitting patient data remotely, and the need for updated patient consent processes. A thorough risk assessment will inform the development of mitigation strategies, such as staff training on telehealth billing codes, implementing secure data transmission protocols, and establishing clear policies for patient engagement and consent. This approach aligns with the ethical imperative to provide safe and effective care while ensuring financial viability and compliance with healthcare regulations. An incorrect approach would be to proceed with telehealth expansion without a formal risk assessment, assuming existing financial and operational frameworks are sufficient. This overlooks the unique billing nuances of telehealth services, such as varying reimbursement rates for different telehealth modalities and the specific documentation requirements for virtual visits, which differ from in-person encounters. Failing to assess cybersecurity risks could lead to data breaches, violating patient privacy laws like HIPAA, and resulting in significant financial penalties and reputational damage. Neglecting to review and update patient consent procedures for telehealth services could lead to non-compliance with informed consent regulations, potentially invalidating services rendered and leading to payment disputes. Professionals should employ a decision-making framework that prioritizes a comprehensive risk assessment before and during the implementation of new service lines like telehealth. This involves forming a multidisciplinary team, including finance, compliance, IT, and clinical staff, to identify potential risks across financial, operational, and regulatory domains. The team should then evaluate the likelihood and impact of each identified risk and develop appropriate control measures. Regular review and updating of this risk assessment are essential as telehealth regulations and technologies evolve. Question 16. Strategic planning requires a thorough understanding of the healthcare regulatory environment. When developing a new service line that involves partnerships with external physician groups for patient referrals, Which of the following approaches best ensures compliance with federal and state healthcare laws? Option A. Implementing the service line immediately to capture market share and addressing any potential regulatory concerns that may arise after the service line is operational. Option B. Focusing primarily on state-specific regulations governing physician partnerships, as these are often more stringent and directly applicable to local operations. Option C. Proceeding with the partnership based on industry norms and assuming that standard referral practices are compliant, as long as the primary goal is to improve patient access to care. Option D. Conducting a comprehensive review of all applicable federal and state laws, including the anti-kickback statute and Stark law, to ensure referral arrangements are structured to avoid prohibited remuneration and self-referral, and seeking legal counsel to validate the proposed structure. The correct answer is D. Conducting a comprehensive review of all applicable federal and state laws, including the anti-kickback statute and Stark law, to ensure referral arrangements are structured to avoid prohibited remuneration and self-referral, and seeking legal counsel to validate the proposed structure. Explanation. This scenario is professionally challenging because healthcare financial professionals must navigate a complex web of federal and state regulations that directly impact operational efficiency, financial viability, and patient care. Misinterpreting or failing to adhere to these laws can lead to severe penalties, including fines, loss of accreditation, and legal action, while also compromising the organization's mission. Careful judgment is required to ensure that strategic decisions are not only financially sound, but also fully compliant with all applicable legal frameworks. The correct approach involves a proactive and comprehensive review of all relevant federal and state healthcare regulations that could affect the organization's strategic initiatives. This includes understanding the nuances of laws such as the Stark Law, Anti-Kickback Statute, HIPAA, and state-specific licensure and operational requirements. By integrating this regulatory understanding into the initial stages of strategic planning, the organization can identify potential compliance risks and opportunities early on, allowing for the development of strategies that are both innovative and legally defensible. This approach ensures that financial planning is grounded in a solid understanding of the legal landscape, minimizing future compliance burdens and potential liabilities. An incorrect approach that focuses solely on maximizing revenue without considering regulatory implications is professionally unacceptable. This failure to integrate compliance into financial strategy can lead to violations of the Anti-Kickback Statute or Stark law, which prohibit offering or receiving remuneration to induce referrals or for designated health services, respectively. Such actions, even if unintentional, can result in significant financial penalties and reputational damage. Another incorrect approach is to prioritize state-level regulations while overlooking federal mandates. While state laws are crucial, federal laws often set a baseline for healthcare operations and financial practices. Ignoring federal requirements, such as those under HIPAA for patient privacy and data security, can expose the organization to federal penalties and undermine its ability to operate nationally or receive federal funding. Furthermore, an approach that relies on outdated regulatory interpretations or assumes that past practices remain compliant is also flawed. The healthcare regulatory environment is dynamic, with frequent updates and new legislation. Failing to stay current with these changes can lead to inadvertent noncompliance, as what was once permissible may now be illegal. The professional decision-making process for similar situations should involve a multidisciplinary team, including legal counsel and compliance officers, from the outset of strategic planning. This team should conduct a thorough regulatory impact assessment for each proposed strategic initiative. Key steps include identifying all applicable federal and state laws, analyzing their potential impact on the initiative, developing mitigation strategies for identified risks, and establishing ongoing monitoring mechanisms to ensure continued compliance. This systematic and informed approach ensures that strategic financial decisions are robust, ethical, and legally sound. Question 17. The monitoring system demonstrates that a significant portion of patient service revenue, after initial billing to third-party payers, is being categorized as pending payer determination for extended periods, with a substantial portion of these pending accounts eventually being written off as bad debt without a clear distinction between contractual adjustments and patient responsibility. What is the most appropriate accounting treatment for the revenue associated with these pending payer determination accounts that are eventually written off? Option A. Immediately classify all amounts not expected to be collected from third-party payers as bad debt expense upon initial billing. Option B. Write off all pending payer determination accounts as bad debt after a predetermined short period, regardless of collection efforts or contractual terms. Option C. Defer recognition of patient service revenue until full payment is received from both third-party payers and patients. Option D. Recognize the revenue at the gross charge amount. Establish a contractual allowance for the expected payer reimbursement based on contract terms, and then establish a provision for doubtful accounts for the estimated uncollectible patient responsibility portion, writing off actual uncollectible amounts as bad debt. The correct answer is D. Recognize the revenue at the gross charge amount. Establish a contractual allowance for the expected payer reimbursement based on contract terms, and then establish a provision for doubtful accounts for the estimated uncollectible patient responsibility portion, writing off actual uncollectible amounts as bad debt. Explanation. This scenario is professionally challenging because it requires a nuanced understanding of revenue cycle accounting principles within the specific regulatory framework of the Certified Healthcare Financial Professional (CHFP) exam, which is presumed to be U.S.-based for this context. The core challenge lies in accurately classifying and accounting for patient service revenue, particularly when dealing with third-party payer contracts and the subsequent identification of potential bad debt. Misclassification can lead to inaccurate financial reporting, non-compliance with payer agreements, and flawed strategic decision-making. Careful judgment is required to distinguish between contractual allowances, estimated uncollectible accounts, and actual bad debt write-offs, all while adhering to generally accepted accounting principles, GAAP, and relevant healthcare industry guidelines. The correct approach involves recognizing that patient service revenue should be recorded at its gross amount, with subsequent adjustments made for contractual allowances based on third-party payer contracts. Any portion of this revenue that is deemed uncollectible after all collection efforts have been exhausted and the account is deemed uncollectible should be recognized as bad debt expense. This aligns with the accrual basis of accounting and the principle of conservatism, ensuring that revenue is recognized when earned and that potential losses are appropriately accounted for. Specifically, under U.S. GAAP, revenue from services is recognized when the services are rendered and are both billable and collectible. The difference between the gross charge and the amount expected to be collected from third-party payers is a contractual allowance, not bad debt. Bad debt arises from the inability of patients to pay their portion of the bill after contractual adjustments and insurance payments have been applied, or when the payer denies the claim and the provider cannot recover the amount. An incorrect approach would be to immediately classify all amounts not expected to be collected from third-party payers as bad debt. This fails to recognize the contractual obligations of payers and misrepresents the organization's revenue and profitability. It bypasses the established contractual allowance mechanism, which is a fundamental component of third-party payer agreements and revenue cycle management. Another incorrect approach would be to defer recognition of revenue until payment is received from all sources, including patient copays and deductibles. This violates the revenue recognition principle under GAAP, which dictates that revenue should be recognized when earned, not solely when cash is received. Finally, an incorrect approach would be to simply write off uncollected patient balances without proper documentation or adherence to established collection policies. This can lead to inaccurate financial statements and potential compliance issues with payers who may have specific requirements for the write-off of patient accounts. Professionals should employ a systematic decision-making framework that begins with understanding the terms of all third-party payer contracts. This includes identifying contractual allowances and reimbursement methodologies. Subsequently, revenue should be recognized at the gross amount, with a corresponding contractual allowance established. For patient responsibility portions, co-pays, deductibles, provision for doubtful accounts should be established based on historical collection experience and current economic conditions. Accounts that remain uncollected after diligent collection efforts and are deemed uncollectible should then be classified as bad debt expense and written off. This process ensures accurate financial reporting, compliance with payer agreements, and effective management of the revenue cycle. Question 18. Cost-benefit analysis shows that investing in a new patient management system is likely to improve operational efficiency and patient satisfaction, but the organization's current financial statements reveal a tightening cash position and increasing long-term liabilities. Which approach best utilizes the information from the balance sheet, income statement, and statement of cash flows to inform the decision regarding the new system? Option A. Focus primarily on the growth in revenue and net income shown on the income statement, as this indicates a healthy organization capable of undertaking new projects, and defer a detailed review of the balance sheet and cash flow statement until after the system is implemented. Option B. Conduct a detailed analysis of the statement of cash flows to understand the sources and uses of cash. Assess the organization's ability to service existing debt and fund new investments, and review the balance sheet for liquidity and solvency ratios to determine if the organization can absorb the capital expenditure without jeopardizing financial stability. Option C. Prioritize the potential operational efficiencies and revenue enhancements indicated by the income statement, assuming the cash flow statement and balance sheet will naturally improve with increased profitability. Option D. Evaluate the current asset levels on the balance sheet and compare them to immediate operating expenses, recommending the system only if current assets significantly exceed immediate liabilities, without a thorough examination of long-term financial health or cash generation capabilities. The correct answer is C. Prioritize the potential operational efficiencies and revenue enhancements indicated by the income statement, assuming the cash flow statement and balance sheet will naturally improve with increased profitability. Explanation. This scenario is professionally challenging because it requires a healthcare financial professional to interpret and apply the principles of financial statement analysis in a way that directly impacts strategic decision-making, without resorting to purely quantitative methods. The challenge lies in understanding the qualitative implications of financial reporting on operational efficiency and future investment, aligning with the Certified Healthcare Financial Professional, CHFP. Exams focus on practical application within the U.S. regulatory framework. The correct approach involves evaluating the strategic implications of the information presented in the balance sheet, income statement, and statement of cash flows to assess the organization's financial health and operational effectiveness. This aligns with U.S. Generally Accepted Accounting Principles, GAAP, and the ethical responsibilities of a CHFP to provide insightful analysis that supports sound financial management. Specifically, understanding how changes in assets and liabilities, balance sheet, revenues and expenses, income statement, and cash inflows and outflows, statement of cash flows, collectively inform decisions about resource allocation, debt management, and investment opportunities is paramount. This approach emphasizes the interconnectedness of the financial statements and their role in strategic planning, a core competency for a CHFP. An incorrect approach that focuses solely on the historical performance without considering future implications fails to meet the forward-looking responsibilities inherent in financial analysis. This overlooks the predictive value of financial statements and can lead to suboptimal strategic choices. Another incorrect approach that prioritizes short-term liquidity over long-term solvency might address immediate cash needs, but could jeopardize the organization's sustainability and ability to invest in future growth or necessary capital improvements, violating the principle of prudent financial stewardship. Finally, an approach that neglects the statement of cash flows, focusing only on accrual-based income and balance sheet figures, misses critical insights into the organization's ability to generate and manage cash, which is essential for operational continuity and meeting financial obligations, a fundamental aspect of financial health under U.S. GAAP. Professionals should employ a decision-making framework that begins with understanding the specific objectives of the analysis. This involves identifying what strategic questions the financial statements are intended to answer. Next, they should systematically review each financial statement, considering its components and their interrelationships. The analysis should then move beyond mere reporting of figures to interpreting trends, identifying potential risks and opportunities, and assessing the organization's financial position and performance in the context of its strategic goals and the broader healthcare environment. This holistic and interpretive approach, grounded in U.S. GAAP and professional ethics, ensures that financial analysis serves as a robust tool for informed decision-making. Question 19. Process analysis reveals a significant increase in claim denials from a major payer, impacting the organization's cash flow. The finance department is under pressure to reduce the denial rate immediately. A senior manager suggests a strategy of writing off all denials below a certain dollar threshold to quickly improve the denial metrics, arguing that the administrative cost of appealing these smaller amounts outweighs the potential recovery. Which of the following approaches best aligns with regulatory requirements and ethical professional conduct for managing this denial trend? Option A. Immediately write off all denials below a specified dollar threshold to reduce administrative burden and improve denial metrics, and focus appeals only on larger dollar amounts. Option B. Implement a robust root cause analysis for all denials, regardless of dollar amount, and pursue a systematic appeals process with thorough documentation, while also identifying and addressing systemic issues contributing to denials. Option C. Submit appeals for all denials without detailed investigation, prioritizing speed to clear the backlog and improve the appearance of denial management. Option D. Focus on negotiating a lump sum settlement with the payer for all past denials, bypassing the standard appeals process to expedite resolution. The correct answer is B. Implement a robust root cause analysis for all denials, regardless of dollar amount, and pursue a systematic appeals process with thorough documentation, while also identifying and addressing systemic issues contributing to denials. Explanation. This scenario presents a professional challenge because it requires balancing the immediate financial pressure of reducing denials with the ethical and regulatory obligation to accurately represent patient care and pursue legitimate reimbursement. The temptation to implement a quick fix that might mask underlying issues is strong, but it risks violating principles of integrity and compliance. Careful judgment is required to ensure that denial management strategies are both effective and ethically sound, adhering to all applicable regulations. The correct approach involves a thorough root cause analysis of denials, followed by a systematic appeals process that is well documented and supported by clinical and financial evidence. This approach is ethically justified because it upholds the principle of honesty and transparency in financial dealings with payers. It is also regulatorily sound, as it aligns with the expectation that healthcare providers will diligently pursue all valid claims and provide accurate information during the appeals process. This method ensures that the organization addresses the fundamental reasons for denials, leading to sustainable improvements and preventing future occurrences, while also respecting the payer's review process. An incorrect approach that focuses solely on writing off denials without investigation fails ethically by not pursuing rightful reimbursement and potentially misrepresenting the value of services rendered. It also fails regulatorily by not adhering to the established appeals processes and potentially creating a pattern of noncompliance with payer contracts and government regulations that mandate proper claim adjudication and dispute resolution. Another incorrect approach, which involves submitting appeals without adequate documentation or a clear understanding of the denial reason, is professionally deficient because it wastes resources and demonstrates a lack of diligence. Ethically, it can be seen as a disingenuous attempt to appeal without a genuine basis, potentially eroding trust with payers. Regulatorily, it may not meet the requirements for a valid appeal, leading to further denials and potential sanctions. Finally, an approach that prioritizes speed over accuracy in the appeals process, leading to the submission of incomplete or inaccurate information, is ethically problematic as it compromises the integrity of the financial reporting and claim submission process. Regulatorily, it can lead to accusations of fraud or misrepresentation, jeopardizing the organization's ability to participate in payer programs. The professional decision-making process for similar situations should involve a commitment to understanding the root causes of denials, a structured and evidence-based appeal strategy, and a continuous improvement mindset. This includes investing in staff training, utilizing technology for tracking and analysis, and fostering a culture of compliance and ethical financial management. When faced with denial trends, the first step should always be to investigate the underlying reasons rather than implementing superficial solutions. Question 20. Consider a scenario where a hospital is exploring a new service line that requires collaboration with a group of independent physicians. The hospital proposes a contractual agreement where the physician group will receive a percentage of the revenue generated from services provided to the hospital's Medicare and Medicaid patients. The hospital's financial team is tasked with assessing the compliance of this proposed arrangement with the anti-kickback statute. Which of the following approaches represents the most prudent risk assessment strategy? Option A. Assuming the arrangement is compliant because the physician group is a well-established entity with a good reputation in the community and has not explicitly stated any intention to solicit referrals. Option B. Proceeding with the arrangement as long as the hospital's internal legal counsel provides a general opinion that such revenue-sharing models are common in the healthcare industry, without a specific analysis of the proposed terms. Option C. Evaluating the proposed compensation structure by comparing it to industry benchmarks for similar services, assessing the medical necessity of the services performed by the physician group, and scrutinizing the overall intent of the arrangement to ensure it does not improperly induce referrals of federal healthcare program business. Option D. Reviewing the proposed contract to ensure it is in writing, signed by both parties, and clearly outlines the services to be provided, assuming that a formal contract negates AKS concerns. The correct answer is D. Reviewing the proposed contract to ensure it is in writing, signed by both parties, and clearly outlines the services to be provided, assuming that a formal contract negates AKS concerns. Explanation. This scenario presents a professional challenge because it requires a nuanced understanding of the Anti-Kickback Statute Acts and its application to common healthcare business arrangements. The core difficulty lies in distinguishing between legitimate business arrangements that may involve financial transactions and those that constitute a legal remuneration intended to induce referrals. A financial professional must exercise careful judgment to avoid even the appearance of impropriety, as violations of the AKS can lead to severe penalties, including criminal prosecution, civil fines, and exclusion from federal healthcare programs. The correct approach involves a thorough risk assessment that meticulously examines the intent and structure of the proposed arrangement. This approach prioritizes identifying any potential for the arrangement to induce or reward referrals of federal healthcare program business. Specifically, it requires evaluating whether the compensation is fair market value for services actually rendered, whether the services are medically necessary, and whether the arrangement could be construed as a disguised payment for referrals. This aligns with the AKS's prohibition on offering, paying, soliciting, or receiving remuneration to induce or reward referrals of items or services reimbursable by federal healthcare programs. The focus on intent, necessity, and fair market value directly addresses the core concerns of the AKS. An incorrect approach that focuses solely on the existence of a written contract without scrutinizing the underlying intent or the reasonableness of the compensation is professionally unacceptable. This failure ignores the AKS's substance over form principle, where the true nature of the transaction, not just its documentation, determines legality. Another incorrect approach that assumes any arrangement with a physician group is permissible as long as it generates revenue for the hospital is also flawed. This overlooks the critical requirement that the revenue must be derived from legitimate, medically necessary services and not from inflated pricing or other mechanisms designed to reward referrals. A third incorrect approach that relies on the absence of explicit discussion about referrals during negotiations is insufficient. The AKS can be violated even without direct conversations about referrals. The intent can be inferred from the circumstances and the structure of the arrangement. Professionals should adopt a decision-making framework that begins with a comprehensive understanding of the AKS and its safe harbors. When evaluating potential arrangements, they should ask, is there a legitimate business purpose? Is the compensation commensurate with the fair market value of services actually rendered? Are the services medically necessary? Could this arrangement reasonably be perceived as an inducement for referrals? If any of these questions raise concerns, further investigation, legal counsel, and potentially restructuring of the arrangement are necessary. The ultimate goal is to ensure that all financial relationships are transparent, commercially reasonable, and free from any intent to improperly influence patient care decisions or referral patterns.